Good afternoon, everyone. Thank you for joining us for the weekly COVID update. I want to thank all our principal entities that come forward every day with information. We're really thinking of the tribal members and community, each of the decisions that are made, each of the announcements that are made, and we're just glad that we could come together this afternoon to continue that work and do everything we can to get vaccinated, mask up, social distance, and continue to pray on it, and everything that the HoChunk people know what to do, have the tools in our hands to do those things. And with that, I continue to advocate for vaccination, and as the discussion continues with the leadership on mandating that, I'll keep you all informed. So with that, I'd like to turn the floor over to our first presenter, our public health expert.
Thank you, Tori. Good evening, Winnebago community. I also know that we're, like Chairwoman Kitchian has mentioned, concerned about the rising cases. We all know that Pfizer, that is 75% of our community has received, is not 100% effective, but it really is our best protection against this virus. I know you're probably tired of hearing us say, but our best defense is still wearing a mask, washing your hands, watching your distance, and really getting vaccinated. So we have started scheduling for our booster clinics for those people that received your second Pfizer dose in January, February, or March. So please give us a call at 878-2258. We are designating, or those were designated high priority areas. So we know that we're going to give priority, of course, to our 65 and older, but then everybody else that was in those months were either teachers, law enforcement, spiritual leaders, and so everybody needs to get signed up so we can get you your booster. And so now I'll start with the latest data and updates. So as of yesterday, we had 7 new positive cases. Currently, we do have 18 active cases for a total of 410 positives. We've had 7 deaths related to COVID-19, 385 that have been recovered. We have 20 households in quarantine, and our vaccination rate is 75% with a community member 12 years and older having at least 1 dose. So this represents the cases breakdown starting back in April of 2020. So as you can see, our ages 20 to 29 years of age have been 27% of our positives, followed by 0 to 19 years of age being 25%. And then our 30 to 39 years of age is about 16%. And then everybody's kind of under that. And then our gender breakdown since April was females making up 53% of our positives and males being 47%. So this shows the breakdown of positives since January of this year when we started our very first vaccine campaign. And so you can see 20 to 29 years of age and 0 to 19 represent equally 24%, followed by our 40 to 49 years of age at 16%. And then roughly females are about 53% of our positives and 47% are males. So this just represents the exposure areas for our COVID-19 in our Winnebago area. Since April of 2020, we had about 219 people that were considered close contacts or households that turned positives. 115 were from social gatherings and about 52 from family gatherings, and then it kind of levels off after that. And then since January 3rd, which is when we start our vaccines, 49 have still been household contacts or close contacts, and then 45 have been from social gatherings, and then 9 from family gatherings. So this just reiterates a positive case, 219, and then an isolated case, there have been 191. So as you can see, starting in April 2020, on the 22nd, we had our very first case, and then we can see the peaks and valleys, and starting of another peak here in September And you can kind of see where some of the holidays fell in, where we had some of those spikes. Okay, so we had 59 that were non-vaccinated, 13 were fully vaccinated, and 1 that had their initial dose and became positive. So this just gives a better percentage of 73% were non-vaccinated, 25% were fully vaccinated, and 2% were vaccinated with 1 initial shot. So you can kind of see the breakdown. So this is the vaccine data. So this is since January 3rd. These are people that are now vaccinated within our community. And so roughly our 19 to 29, 19% of our vaccinated is amongst that group. And then between 50 and 59, 40 and 49, and 30 and 39, there's about 15% in each of those categories. And then we have our females at 56% are vaccinated, and males make up the other 44%. And then the unvaccinated population in Winnebago, I can't quite see the bottom. So 19 to 29 makes up the larger group, and followed by 25% in the 12 to 15-year-old age, and 30 to 39 makes up about 16%. And then we have our males making up 53% of the unvaccinated population, and 47% are females. And so I thought this was a little bit more representation of the actual vaccinated in each age group. So you can see 96% of our 70 and older are vaccinated. 91% of our 60 to 69 years of age are vaccinated. Then it slowly trickles down to where we get to our about half of our 12 to 15-year-olds are vaccinated. So we really need to get our younger population in to be vaccinated. So I know there's been a lot of questions about the federal vaccine approval process. And so we wanted to just try to outline that. So, because once you see it on TV, it doesn't mean that it's, ready to go. And so we get kind of some angry people and concerned people that we're not starting already. And so when the FDA, it's presented to the FDA, and so they review it. They look at the pharmaceutical companies. Within FDA, they have a committee called the Vaccines and Related Biological Products Advisory Committee, and they hold a meeting and review all the data, the safety, the effectiveness, the appropriate use of the vaccine, and then they advise the FDA. So then the FDA determines if the vaccine will cause more benefit than harm and decide if an emergency use authorization will be granted for the vaccine. So if FDA decides that they're granting a EUA, then it's turned over to the Centers of Disease Control, and they have a committee, which is called the Advisory Committee on Immunization Practices, or ACIP. They will hold an emergency meeting with public comment session to review the safety and the efficacy data. The ACIP will then vote on those recommendations for the vaccine, prioritization of the vaccine within the populations, and then the ACIP will then submit it to the CDC director. Then they publish it in the Morbidity and Mortality Weekly Report, and then guidance is given and distributed to our staff in order to administer it. So there's a little bit of a lengthy process.
Thank you, Mona. And I did want to mention that for flu shots, they're now available at the hospital pharmacy. You can receive flu shots anytime, Monday through Friday, from 8 a.m. to 4 p.m. And we already are seeing some flu cases. And I know the CDC and FDA are saying that this fall will be, they expect the cases for COVID and flu to see an uptick. So they're highly encouraging anyone over 6 months old to get the flu shot. So you can get those 15 patients 15 years and older can get those through the pharmacy. And you can call the pharmacy. The number is 878-3700. If you would like to get more information on that, you do not need an appointment. You could just walk up and request a flu shot. However, if you are under the age of 15, you will need to schedule an appointment through the outpatient department to receive a flu shot. And appointments can be made by calling the 878-3404 number, which is the outpatient department. And the CDC is recommending that in order to protect yourself, your family, and your friends from the flu, that you should get the flu shot by October, the end of October. So that concludes our presentation for WCHS for this month. We will now turn it over to Dan Farringer for an update from Winnebago Public Schools. Dan?
Good afternoon, everyone. School's back in full swing. We are requiring masks. Again, with fall sports are underway, and we're proud of our student athletes. They're taking it serious. We have only had one case, and we're still participating in all the events. The WPS return to school plan is posted on the school's website. We did return to an in-person educational setting. Again, to reiterate the vaccination, the clinic will be held at the school starting Wednesday, the 6th. Again, call in to make the appointments that's listed on the number on the flyer. They'll be at the practice gym like they were last year, starting this Wednesday at 9 o'clock. The National Indian Education Conference is in Omaha this year, October 13th through the 16th. The NIEA is sponsoring student days on Friday the 15th and Saturday the 16th. High school students who wish to attend will sign up and need a permission form signed by the parent and guardian. Those forms will come out next week. Transportation will be provided by the school for the students. More information regarding that will come out again next week. We continue to keep the building and classrooms disinfected, wear masks, use hand sanitizer, and social distance when possible. Again, it's imperative that we follow the health safety measures and we practice them, and then again, stay safe. Thank you.
Thank you, Dan. Next, we will go to Manoj from a update from Little Priest Tribal College.
Thank you, Emily. Good afternoon, everybody. Before we get started, I would like to read a statement we put on our Facebook and website on the National Native American Boarding School Day of Remembrance. Today, September 30th, Little Priest Tribal College stands in solidarity with all of Indian country for National Native American Boarding School Day of Remembrance. LPTC honors the memory of the children that never returned home. We stay committed in our efforts to educate about Indian missions and boarding schools and the impact they had on Indigenous people. We'll continue to tell their stories in our courses. We pray for healing for all those affected by Indian missions and boarding schools. The second update is many of the community members may be aware that I had to make a tough decision yesterday, 2 days actually back, to move all our operations virtual. We had 2 of our employees test positive, and the employees have come in contact with several others. So we did contact tracing, and so far all the tests have been negative. So in just in great caution and abundance of caution, I decided to move the operations to virtual till October 8th. The Wolves Den cafeterias will be closed, but all the classes, the offices will be virtual. So please make sure, students, if you're listening to this, if you need any assistance, please do not hesitate to contact us, either by phone, email, Facebook, or whatever the platform you're looking for. We are here to assist you. Little Priest Tribal College this fall semester had a 3rd highest record enrollment of 165 students. In the last 23 years of the existence of the college, we had a high enrollment. So I just want to take this opportunity to thank all the staff, the faculty, the community, the students, the parents for pushing the Little Priest Tribal College forward and be a great advocate for higher education in the community. I also want to thank the people who attended the green corn dance and traditional powwow. And also want to especially give a huge shout out to the cooks who made our meals, traditional meal, and Little Priest Tribal College was a sponsor for the meal on that day. Our spring 2022 schedule is getting worked on. We should have it out to the public very, very soon. So I request all students who will be taking classes in spring to register right away, because we are finding out some of the classes are getting filled up faster than the others, and we don't want you to lose a spot. Just like last fall semester, spring semester will be free classes. If you're a new student, free laptop, free books, and our dorms are also available for free for community members and others. So again, this is an ideal opportunity for our community to continue exercising their educational path to learn and to get a higher degree. Excuse me. The college is at now 80.2% employees vaccinated. That has been stabilized for last, I would say, almost 6 months. So I would encourage all my employees to really think through this and really make an effort to get vaccinated. So talk to the public health, your medical officers, doctors, to take the right decision. Classes at Little Priest Tribal College are going great. As mentioned the last time, we have a new attendance policy, which is strictly getting followed, and we are seeing a better retention of the students. So I want to commend the faculty and the students for doing their due diligence. September 13th to 17th was Chief Little Priest Week. I know many of the community members attended some of the presentations, so I just want to thank the community members who attended and all the staff who made it happen at our college. So we continue to fight this pandemic. Again, we really hope that we return back to campus operations starting October 11th. We'll keep you posted on Facebook and website. Again, I want to request everybody to follow strict safety guidelines and get vaccinated. Thank you, and have a good day.
Thank you, Manoj. Lastly, we will go to Lily Bass for an update from HoChunk Inc. Lily?
Thank you, Emily. I have a few updates from HoChunk Inc. And one of them is that we really wanted to thank the community and all the partners for a successful community celebration that we held at the Veterans Memorial Park, also known as the Powwow Grounds. It was very well received. And we just wanted to also remind the viewers that we do have an upcoming Facebook Live event. We're going to announce door prize drawings. So we'll have an announcement tomorrow on details about that, so stay tuned. And then also, secondly, we wanted to let the viewers know that we have several different photo galleries on Facebook right now on the HoChunk Inc. Community Impact and Engagement Facebook page, and they capture all of our recent community activities, including the Winnebago Public School Homecoming Parade and activities and the football game, as well as the Indian corn harvest. So be sure to drop by the Facebook page and check out those photos and give us a like, make some comments. The community really enjoys those things. And thirdly and finally, we wanted to thank HoChunk Renaissance and say Pinagigi, them, as well as the partners who had a hand in organizing the green corn harvest celebration and powwow. We wanted to also say that HoChunk Inc. employees were honored to present a donation check to HoChunk Renaissance at this event. And it was actually the first of 2 donation amounts that will total $50,000. And this will be used for Winnebago language and culture education. Those are the 3 updates that we have from HoChunk Inc. Pinagigi, thank you for your time.
Thank you, Lily. Now we will go on to the question and answer portion of today's update. You can email your questions regarding COVID-19 to covid@winnebagotribe.com, and we always do our best to answer them. So thank you to everyone who submitted questions to the email, or you could message the tribe's Facebook page as well. And here are some of the questions that were asked by community members for this edition of the community update. So the first question is, could the Winnebago Public Health post the breakdown of new cases and how many are vaccinated and unvaccinated and those under 12 ineligible? Mona, can you take that?
Yeah, we can definitely start looking at developing that and putting that out. So just so you know, so for this past week, we have had 7 vaccinated, 7 unvaccinated, and 1 that was under 11.
Okay, thank you for that information, Mona. The next question was, is it true that HCI and Little Priest, or HoChunk Inc. and Little Priest shut down? So I'm going to direct that question to Willie to first talk about HoChunk Inc., and then we'll go to Manoj.
So HoChunk Inc. continues to operate, and under the current guidelines, that includes wearing a mask indoors at all locations on the Winnebago reservation.
Okay, great. So just to be clear, HoChunk Inc. has not shut down. And Manoj, can you comment on Little Priest? I know you kind of covered this, but just to reiterate it.
Yes, Little Priest Tribal College has shut down its campus operations, but all office classes are still virtual. All employees are working from home. We have call forwarding enabled at the college, so including the Woods Den is closed. So the campus is physically is closed, but the operations is still on. So please, students, if you're listening, again, continue talking to your faculty and teachers and community members. If you have any questions, get hold of us by phone, email, Facebook. Thank you.
Okay, and I think, do we have Chairwoman Kitchion back on? Are you able to speak, Chairwoman? I think we're having some technical difficulties, so I'll just move on to the next question for the health department. Was a spike in cases related to the harvest celebration? Mona, can you answer that?
Sure. So no, we have no evidence that any of these cases that are occurring this week are linked to the harvest celebration. There are several that are linked to each other. So like we talked about, close contacts within a family, and of course, unvaccinated are at very high risk, especially for the Delta variant that is predominant in the country. So the answer is no.
Okay, thank you, Mona. And that concludes the COVID-19 health-related questions for today. So a reminder to sign up for your Pfizer vaccine through the health department by calling 402-878-2258, or you can go to the public health department's website at www.winnebagopublichealth.com/vaccine, and there's a sign-up form there that will submit your information to the health department, and somebody will call you to schedule an appointment. And again, they are opening up the clinic to those who need their 3rd booster shot, which is recommended for anybody who had gotten the first 2 doses of the Pfizer series on or before March of this year. So if you have gotten the first 2 doses of the Pfizer and it's been 6 months, you are encouraged to call the health department at the 2258 number to schedule your 3rd dose of the Pfizer vaccine. So that concludes everything we had to cover today. Make sure to tune in to our Facebook page, like the Winnebago Public Health Department and 12 Plans Hospital on our Facebook page to stay up to date on the most relevant and timely COVID-19 information. And we will see you all next month. Thank you so much for joining in.